The first country in the West to approve a vaccine was the UK earlier this week. There were questions from Dr. Fauci of the US whether they had been too quick. Your thoughts? That was a little bit walked down afterwards, but your thoughts on that?
Yeah, the data that was submitted to the UK and to the United States FDA are essentially the same sets of data. There was one mitigating factor. I think the FDA wanted to hear the US CDC's recommendations for high priority groups for vaccinations. That meeting was scheduled this week and happened, and that's where we get the U.S. recommendations that healthcare workers and residents communities for the elderly are the high priorities. So the FDA was waiting for that CDC note. They're looking at the same data as the UK, and not that I have a crystal ball, but I imagine that we'll see the same recommendation that the vaccination go forward with Pfizer once the FDA goes through their packet of information.
And how quickly, then, could we see approval in the U.S.? And does a couple of weeks' difference actually matter?
The logistics of vaccination are the critical things. Everybody is now organized and set to receive these first batches of the vaccines. It seems like the trucks have their engines on and are all loaded up and just waiting for that FDA approval to happen. So you imagine here in the U.S. that there will be immediately shipments of vaccine to centralized areas that are going to begin their vaccination programs in those high priority groups. Those groups have already been prepared for this. Most of them are medical centers who are used to vaccinating their workers. So plans have all been put in place. Priority groups have been put in place for the logistics of rolling out who gets the vaccine and when. And, of course, to plan the initial doses versus the booster doses, because 4 weeks from now, we're going to have twice as many people lining up for vaccines because we're going to have people lining up for the initial dose as well as their booster. And all that takes a lot of planning and organization.
Andrew, we also need to talk a little bit about, of course, the self-isolation period. So the guidelines around that have changed. We've shortened the amount of time. Is it because there's new information about how long it takes to get infected, or is it just to counter quarantine or isolation fatigue?
Well, hopefully it accomplishes both. A lot of data that's come out over the last 6 months has really pointed to sort of the first 7 days after an exposure as being the most critical time that you can spread the virus. If you're not showing symptoms, if you've got a negative test during that period of time, it doesn't seem like 14 days buys us much more in terms of protection from transmission. So the guidelines now are really taking into account, do you have a negative test? Are you showing any symptoms? And if you have a negative test or you're not showing symptoms, then the isolation period is going down to 10 days. One hopes that that will help relieve some of this pandemic fatigue. One also hopes that it'll increase compliance, because with a shorter period of time that you can self-isolate, people may be more willing to do that, and therefore we'll still be accomplishing our goal, which is minimizing transmission while trying to also minimize the burden that people have in terms of their self-isolation and their inability to work and so on and so forth.